Hyperkyphosis in the thoracic vertebrae. What is kyphotic position? Kyphosis is a condition in which the thoracic vertebrae develop excessive curvature. Great convexivity of the thoracic chest vertebrae, which is also characterized by a forward tilting of the shoulders and head. In addition, excessive curvatures may also be created in the cervical and lumbar spine as part of compensatory processes created by the body. The therapeutic aspects to emphasize and the definition of potential for improvement are predicted on an orderly diagnostic procedure that takes into account the severity of the disformation and identification of the source of the problem, structural or functional. What does the normal situation look like? The spinal curves in a normative range. In normal conditions, a slight and moderate kyphosis is visible in the thoracic vertebrae, T1 to 12. What does a deformed condition look like? The thoracic vertebrae are excessively convex, with the shoulders and head tilted forward. In addition, excessive curvatures may also be created in the cervical and lumbar spine as part of the compensatory processes created by the body to enable better functioning. The spinal curves are measured objectively in degrees by X-ray, and the normative angle for back kyphosis is between 30 and 40 degrees. In this position, we can see an excessive convex 45 degree and greater. Prolonged sitting in a flexed posture. Part 1. Biomechanical symptoms. Lower body. Do you recognize this sitting position? Do you sit most hours of the day? Do you feel discomfort or pain in your upper or lower back? What happens to your body when you slump in your chair for too long? Prolonged sitting in this position will in time cause rigidity and tightness in the tight muscles, and we can see them colored in blue. Now, these are chronically short muscles, what we call locked short. In addition to the posterior leg muscles, the hip flexors are also chronically short from prolonged sitting. Rigidity in the hip flexors is a direct cause of weakness in the antagonist hip extenders. Muscle imbalance. Muscle imbalances are the #1 cause of lower back pain. What happens to the sacroiliac joint? The joint between the sacrum and the pelvic bones. The sacroiliac joint and the sacroiliac ligaments are under load. What happens to the lumbar spine? Here we can see a neutral spine and lumbar flexion. In prolonged slumped posture, the lumbar spine is flexed over time. Damage includes increase in posterior annulus strain, damage to the annulus of the disc, increase in intradiscal pressure. What happens to the connective tissues? Flexed postures place stress on the posterior passive tissues. In addition, the posterior ligaments are also impaired. Common characteristics of kyphosis. Common characteristics of kyphosis. Rounded back with greater thoracic curve. Shoulders slouch forward and the scapula are in protraction. The head tilts forward. Thoracic rigidity or stiffness, mainly in extension and rotation of the thoracic vertebrae. Difficulty in performing straightening and extension of the thoracic vertebrae. Compensation, shoulder raising, tilting the pelvis anteriorly. Chin up. Scapular protraction because of the shortening of the pectoralis minor. Anterior arm tilt, mainly because of the shortening of the pectoralis major. When the deformation stems from a structural source, it is more prominent when lying down. A rigid kyphosis also prominent during spinal rotation. Horizontal plane. The chest muscles, pectoralis major and minor, are short. Weakness in the deep erector spinal muscles and the scapular retractors. Greater curves may be created in the cervical and lumbar vertebrae as well as a result of the body's compensatory process. Short cervical extensors and SCM. Short superficial breathing because of limited chest cavity mobility. Short hamstrings. Low body awareness. Common characteristics of kyphosis.